Are you facing challenges in your health? Then Dr. Suleiman Clinic and Labs is here to provide you with the lasting solutions to your health problems. Dr. Suleiman Clinic and Labs is specialized and offers consulting in psychiatry, internal medicine, cardiology, urology, dermatology, gynecology, infectious diseases, and infertility. At Dr. Suleiman Clinic and Labs, we offer 3D/4D scan at just 5,000 francs, emergency ambulance, free ultrasound scan, and free medical consultations. Our staff is composed of well-trained doctors with good laboratory and best equipment. We are located in 2 cities, Boya at Mile 18 Bulifamba, and in Douala, we are located at Entrepilot. You can reach us through the telephone number 694-940-172. Your health is at the right place with Dr. Suleiman.
We're going to talk about something called malabsorption. Malabsorption is another common condition also. Malabsorption meaning you eat the food, and the whole target of the food is to convert it into the simplest form, like carbohydrates, which is starch, potatoes. You have to convert it into the simplest form, which is sugar, glucose, protein, that is fish, chicken, meat. We have to convert it into the simplest form, which is amino acids. Fat, which is the fat and the oils that you take, we have to convert it into the simplest form, which is fatty acids. So glucose, amino acids, fatty acids, in addition to the minerals, calcium, potassium, magnesium, all this has to make it from your mouth all the way to the intestine. And the border of the intestine, we call it the villi of the intestine, this is the cutoff end whereby the food goes from your mouth into the bloodstream. Because food in the intestine and remain in the intestine is not of use to me. Food in the stomach and remains in the stomach is not of use to me. So everything I eat, the whole goal, the whole target is to get it to the bloodstream. And how do I get it? Final stage of digestion is absorption through the wall of the small intestine. So it's through the wall of the small intestine that all this food that has been transformed into the simplest form make its way to the bloodstream. And this is when we can use it for different, for calories, for metabolism, for build your cells, renew all the hormones, everything. We need all those 3 main categories: sugars, glucose, there is fructose, there is other sugars as well, the simplest form of the protein, which is the amino acid, the simplest form of the fat, which is the fatty acids. We need all those to go into the bloodstream to do their work, to renew all our cells, to have all our hormones, and for us to live, to provide us with calories so we can have energy and move and do our daily function in life. What if the border where those simple guys there, the amino acids, the fatty acids, the sugars, and the minerals and vitamins cannot make it across from the intestine to the bloodstream? Then we have a problem. And this is what we call malabsorption. What happened there? In order for us to have these units transferred from inside the intestine to the bloodstream, we need to go through the villi. The villi is projection-like things that's inside the wall of the intestine, that its whole function is to transport this simple form of the food into the bloodstream. What if I have a disease that eats up those villi, like celiac disease, for example? It's rare. I have not seen it. Maybe very few cases in Cameroon, but in the West it's very common. Those people in the West and some in Northern Africa also, they are very sensitive to some ingredients in the flour called gluten. This gluten, if they take bread and the gluten inside, even the smallest amount, can go and attack those villi that is responsible for absorption and wipe off the villi. And if we do endoscopy, we can see that the villi responsible for absorption has been wiped out because of a small disease called gluten disease, and that is genetic, genetically induced. Those people are very sensitive to gluten. They cannot take flour or anything that contain flour. Okay, so this is the treatment is we avoid gluten. So we find anything, before I put something in my mouth, I'm sure that it doesn't have gluten, then I will take this substance or I take this food comfortably without any problem. A second disease that is called Wibble disease. Wibble disease is actually the same thing. It wipes off the villi, but it comes with a different manifestation. Since it's a bacteria, then it has to come with fever. So we'll have a patient that has abdominal pain and rash on the skin. The skin have rash, abdominal pain and rash, and sometimes fever. And it causes weight loss because you're not absorbing. So obviously you're going to lose weight because you eat, but you cannot absorb. Now, the most important sign in this case is steatorrhea. Steatorrhea meaning the fat, when you do not digest the fat, so the fat has not been able to be absorbed into the blood. So if it's not going into the blood, it stays in the GI tract, so it makes its way into the toilet, in the stools. So when we have this stools, you will see the stools is fatty and greasy, and it floats. It doesn't sink like it's supposed to. So the stool is supposed to sink in the toilet, but when you see the stool floating, this is a problem with absorption. They have not absorbed very well. That's why we have fat in the stools. So Wibble disease is not very common, is rare. So let's now talk about another topic that is very important for us. Anyway, we do a test to determine, very simple test, to determine. We don't have to go through invasive procedure, endoscope and CT scan, and the patient ends up with millions in expenditure, but we have not gotten anything, and those procedures also have their own side effects and their own risk. We do a small test called D-xylose. It's a small thing you check by mouth, and then we scan you and we see if the test is normal, your intestine is normal. So we cancel out all those unnecessary invasive procedure to find out if your intestine is working or not. We give you a small something if the test is normal, then called D-xylose. If the test is normal, your intestine is normal. That is the end of the story. So we have to look for something else. So D-xylose is normal, the intestine is normal. We don't need to go through invasive procedure. So this is the malabsorption, and there are many types of malabsorption. We just discussed two.